All right. Hello, my friend Mac.
Hey girl, how are you today? Good
Oh,
to see you.
I'm always
Good to
happy
see you.
to see you. I love our conversations, and I
I
hope
do too.
you're loving it too.
Exciting. We keep it going. Let's get it going. Let's go. What you got?
Well, today I was wanting to talk about why our faces are shrinking, our jaws are shrinking in modern day faces. Have you heard that?
Yes, I have, and I've been hearing it for quite a while. In fact, it goes back to Winston Price, a book I read 30, 40 years ago.
Mhm.
The guy traveled all over the world where there was no refined sugars, carbohydrates, and all of the pollutions that we have today, and that the jaws of the natives were full and they had room for their wisdom teeth, and that is no longer true. But I didn't do a lot of study on it, and I know that Dr. Pam Marsban did a lots of studying on it and is
Kelly.
going to be our mentor today and to fill us in why jaws are getting smaller.
So this is a true anthropologic fact. We look at our ancestors, like you said, and they have a full 30 set of 32 teeth in their mouth. So and not only do they have their 32 teeth, meaning wisdom teeth and all, but there's actually a centimeter of space, which is the size of most of our thumbs, behind those wisdom teeth. But as we've modernized and we don't have to eat raw foods and really masticate our foods, and then with the rise of agriculture and industrialization, we are now using our jaws less and less. Aside from that, you and I have talked, so much about the fact that there's something called poor resting oral posture because people are no longer breathing through their nose. There's a wide epidemic of this mouth breathing issue that's going on. So when we look at skulls now, especially in first world areas, although we see it in third world areas as well, but we take a look at the skull of now as compared to our ancestors, we see that our entire midface and mandible is a much more narrower structure and also flatter structure. And if you actually look at the areas that have the nose holes in the base of the cranium, those structures are also much smaller than our ancestors. And so, what that looks like or manifests to modern day is, everyone getting these crooked teeth. And that's why it's not even a conversation of, are you going to need braces? It's like, when are you going to do braces? And, you know, when one of the big, I think, questions or confusing points with people coming in, parents are like, why shouldn't I just wait to have all my kids' teeth come out? And, then wait until their grown-up teeth come in. Don't the jaws get bigger as they grow? So aren't they going to get more space? And that's not true. About 90% of our craniofacial development is done by the age of 10, period.
10 years old.
10 years old. Okay. So back in my day, and probably your day too, Mac, is like everyone did wait till the child is like anywhere between the ages of 12 and 17 because all their adult teeth are in. And then they got braces, you know? Sometimes the jaws were already so much smaller than their adult teeth that they pulled teeth, not the wisdom teeth, but their middle teeth, the bicuspid teeth to now try to get the teeth to look nice and straight. And somewhere down the road, something really important got lost. It became about straight smiles and nothing else, straight teeth. It became just a conversation of smile aesthetics, where now people are starting to recognize, whoa, whoa, I can have a nice straight smile, but what the heck happened to my face? My jaw is back here. I have this weak jaw and I don't like it. Why am I grinding my teeth? Why do I have joint pain, but I have a straight smile? Why do I have sleep apnea? And it's not just us as an adult or a teen, but we're even seeing it in the younger ages. So I'm hoping that as we open up in our podcast, we're getting people to stop thinking about straight teeth because you can do that. But I'd rather we think about craniofacial development. In our office, the way my team and I try to explain it to our patients, because a lot of my talking, my team does. They're well trained and they know what to look for. They're taught well. Is that, yeah, if a parent comes in like, why don't I just wait till, the teeth all come out and adult teeth come in, then we have straight teeth. Well, honey, you can go just about anywhere nowadays and get straight teeth. But if you want to talk about having a beautiful straight smile, but also a gorgeous full face that allows for a patent airway and good TMJ function, then you're going to have to look at these kids a lot earlier. And so we look at children starting at the age of 2 in our office. And we start, if we can identify that, their baby teeth, their little jaws are already going to be too small for the grown-up teeth coming in, we can start diagnosing that earlier on and doing growth guided appliances at incremental phasing, into incremental growth, if you will, to start getting these kids' faces to start developing better. Yes, sir.
Growth guided appliance.
Correct.
Okay, so give me a mental picture of what that looks like for our listeners and explain growth guiding because you've got these youngsters, and you'll say what age, that the palate has not yet, the roof of the mouth is yet not fused. Like I've said before, if you want to bend a tree and you got to do it when it's a sapling. And
Mhm.
so this is the same thing, but when you say growth guided, that makes me think at different ages and different increments that you're guiding in different spots. Am I correct on that? Because I haven't done that before.
Different directions.
Different directions.
Yes. So most of our listeners are going to think of these appliances as some type of expanders. And yes, they are. And nowadays, because of the internet, people are Googling up, are you doing a Herbst appliance? Are you doing a
Right.
Tweedlock? Are you doing a sagittal appliance? I mean, sometimes the patient, it's great to have an understanding, but there's not like one appliance that does the magic trick for every single person that walks in the door. Every child has to be looked at uniquely. Some of the kids are starting to grow deficient in width. Some of them are growing deficient and they're getting flat. There's that mid-face deficiency you and I refer to all the time. So we have to look at what caused this deficiency. Is it the airway? Is it the tongue posturing? And then we order different appliances. They could have acrylic in it. They could be soft plastic. It could be a lower appliance that sits on the lower teeth. It could be an upper appliance that fits on the upper jaw. It could be one that's glued in, one that's removable. We have to see what that child needs and also what their compliance is like. But wait, what makes my team and our office so different is that we spend a lot of time on the phase 1 treatment of craniofacial development. And if a child starts with us by the age of 2, just because we do maybe one, or, we don't usually, just because we might do like an expander or a growth guided appliance and finish with it by 3 or in a year, doesn't mean we're done. It means, okay, we're done for this little bit now. And then we have to see how that child grows. So let me kind of back up a little bit. So you take a child that comes in at like 4 years old. At 4 years old, they have all of their baby teeth, all 20 teeth, 10 upper, 10 lower. And if your child has that perfect smile where there's no gaps, and that everything looks straight, that doesn't mean they have enough room for their adult teeth. That's actually a red flag. You want them to have big gaps between all of their teeth, and then you don't want their bite when they put together to be so overclosed. You need to be able to see about 80% of their lower teeth when they bite down in the front, okay? If that child also has a gummy smile, those are things that you could be looking for in your child. But when that child at 4 years old comes in with a consultation, and it's just a growth assessment consultation, we need to take some imaging, whether it's a 3D scan or an oral X-ray, to see what the size of the adult teeth are in the bone, because you can't see that visually. I know that child's going to need space, but I don't know how much space. So when I take an image, I can measure and see how much space that child's going to need. And let's say they're missing 10 millimeters of where they should be. That's a lot of space. At 4 years old, I'm not going to put an appliance that's going to blow up that child's face, expand it 10 millimeters. You can't do that. There's certain physiology and anatomy we have to respect. So we can do first phase appliance, expand them to that capacity, and now they have space for their front two teeth, grown-up teeth to come down. And then you wait. You work on their lip posture, breathing through their nose, and we bring them in every 6 months to monitor their growth. And then, okay, now are the next one struggling? Okay, well, let's put you in another type of growth guided appliance. Let the jaw grow a little bit more. That way, the adult teeth don't get trapped in. That way, the jaw grows naturally with the body and allows the teeth to drop in, at the proper time in the proper position. So, a lot of these kids, by the age of 10, we know if they're growing on trajectory, they're not going to even need phase two braces of any sort. If they do, maybe it's because there's a minor rotation. It's cosmetic. That's when we're doing dental alignment. Dental alignment is totally different than cranial facial development that gives you the straight teeth, the good airway, and the good jaw function. Phase one is, more time consuming. It's more expensive in our office for sure because we spend most of that time at phase one so that we can avoid a phase two. That makes sense?
Well, yeah, what I'm seeing is a really dedicated staff and a dedicated doctor and a dedicated parent and
Yes.
hopefully a dedicated child,
Mhm.
to accomplish this. This is very complicated, but the common sense behind it is just that's what it is. It's common sense. So if
Yeah.
you look at these people way back hundreds of years ago, that everything was beautiful with the 32 teeth, the tongue worked right, the breathing worked right, there were no allergies, they were chewing the tough food. And what that did is expand both the upper and lower jaws that gave room. And I like what you're saying. The teeth just drop into place as Mother Nature intended for them to drop in place. No different than another animal that doesn't eat the bad stuff and do the things that we humans have done over the last couple of hundred years. I think this is just fascinating. And so genetics do play a role. But there's a thing called epigenetics where you can kind of override,
Mhm.
maybe from, in your case, a physical standpoint, you're physically overriding what the genetics is trying to do. Am I on target here, or can you explain that a little bit better?
I think you're exactly on target. When parents come in with their children, they're like, oh my goodness, my child looks like me and I look like my parent. And maybe this is just the way we're supposed to look. I'm like, maybe, but your genotype doesn't necessarily have to express your phenotype. Meaning, what if you, parent, suffered from sensitivities to an environmental allergy that that no one diagnosed? And because you had a mouth breathing issue that nobody talked about either, your jaw developed, more narrow and flat than it could have, meaning your facial expression never came to full expression. But had somebody actually diagnosed and seen what your struggles were and they managed and helped you with that, would you have looked different? And being in private practice and doing this for a long time now, I'm saying the answer is yes. Because if that child has the same allergies, the same sensitivity as the parent, well, we have the opportunity to make that child much better looking person than their parents.
So let's make it real. You have a beautiful mother, but yet she has a recessed jaw.
Mhm.
Recessed meaning it's a little bit further back than the upper jaw. And when she bites down, you can't see her bottom teeth if she's smiling because like you said, it's over closed. And the child is starting to develop and look just like the mom. And the mom is saying, "Gosh, I wish my daughter had the opportunity to have a fuller face, like I wish I had that opportunity." You're telling me that you could give that child a fuller face, even though they have the genetics of the mother, and at this
Absolutely.
stage in life, they starting to look like the mother.
Absolutely. Absolutely. Yes. And that. And what's really challenging too is when you get kids that are, two through the age of 7, 8, their head is disproportionately bigger than the rest of their body. So they look super cute. And these mid-face issues and small jaw issues are being undiagnosed because they look, quote, normal until they hit their early teens and they hit a massive growth spurt. And then their bodies start to catch up with their face that has almost stopped growing. There's only 10% of growth that occurs up until the age of like 17, 18 at this point. And then the face starts to look unattractive or recessed. And then it's like, uh-oh, let's, now start to fix it. Or maybe they don't even recognize the weak jaw because dad has it or mom has it, and that's normal. But let's fix those crooked teeth, because everybody doesn't sees crooked teeth. So if it's caught early enough, like you just said, you bend a tree when it's young. And if you wait till the age of 10, you're waiting too long. And I have professionally made that mistake too, and oh, let's get a little spicy again.
Oh, go, come on, girl. Let's get it. Tell it like it is. Tell it like it is.
So to my orthodontic colleagues, and I hope still friends, you know, what they're being taught in their residencies is to screen patients starting at the age of 7. And the reason why is because at the age of 7, kids are a lot easier to handle. No doctor wants to deal with a screaming kid that's going to set their schedule back, especially when you're seeing 50 to 70 children a day. I get that, but that's why I see maybe 18 to 20 tops because I need to be able to work and manage those kids. It's too important to me.
Well, oh, and what you're saying makes total sense. I become a better grandfather when they're about 7 or 8 years old than when they're,
That
when
why
they're
you're
five.
laughing so big?
Because you can rationally talk to them. And so it's that's a real problem. But since it's a problem, it needs to be discussed.
Mm,
The problems are the same, the solutions are the same.
mm,
The problem is I don't want to work on this child because that you can't get them to cooperate and not easy to work on at 3 years old. But that's when you bend the tree.
right, right.
And if the objective is to bend the tree the way you want it to look beautiful, then that's when you do it. It's just common sense.
So I had this mom come in. She's brought in her 6-year-old daughter that's working with my mom, functional therapist, and her 3-year-old son. And I can tell she is, busy, 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 stressed out. Here I am for another doctor's appointment and shuttling her kids and managing her professional life and personal life. And she looks at me, she's like, I mean, I just don't understand. Why shouldn't I just, because she was referred to me by another doctor because her daughter has sleep disorder issues already, right? She's like, why don't I just wait till, all the teeth come in and just do this all at once in their teens and be done with it? And I was like, well, you can, you totally can do that. I just want you to understand your goals are going to be different and that's what you want. And that's what you're going to get. So if your goals are for your daughter to have like straight teeth later, you could wait. But you were referred to me because your daughter has sleep issues, meaning there's airway constriction already, meaning that the jaw's too far set back. So if you're willing, the path you're taking with me, which is craniofacial development first, phase 1, it's more arduous. You're going to be going through different appliances. I don't even know exactly how many because I can't predict how your daughter is going to grow. I could set her on better paths and trajectories, but then you might get a dog or she might develop an allergy and then things start to go in the wrong direction. So it means you're going to have more visits here. And if you're willing to do that, then you're going to set her up great for her early teens and set her up for a much better lifetime of possibilities as an adult, but it is a more arduous path. She's like, is it more expensive? I'm like, I don't think so. Our phase 1 treatment is probably twice the cost of an orthodontist or another generalist does treatment. But because we're working on not just like jaw development, we're working on airway, we're trying to get the face to naturally do what it was supposed to do.
Correct.
So it's a lot of appointments, and parents have to be on board because we're not going to be like the airway police at our office. It is work on the parents' part and the kids and our part. We all have jobs, and they need to be accountable for it. And when they are, magic happens. It's magical. And the kids don't even need any orthodontic treatment at the end.
But it's magical only if it's done correctly with everybody involved, like you said, because here's a scenario that I would have faced if I did the kind of dentistry you did, is that if they had an airway issue, who would I send them to? If they had a tongue tie issue and they wanted to check with their pediatrician to see if they needed a tongue tie, you're going to get shot down.
Mm.
And so you need, in your case, and you do a great job of finding the right professional that will work with you on these issues because everything is a team. It takes a village for these children to be able to get it right. And my hat's off for you for doing this incredible job.
Thank you, Mac. I get it to our listeners. I get it that it's the visits can feel arduous, and I get that it can seem expensive. But I've been doing this type of treatment for 25 years, and I don't know what you define expensive because let me fast forward a potential life, okay? Is it more expensive to avoid craniofacial development and not deal with that, and then watch a child, which I do, see these things grow into teenagers that have grinding patterns, a little bit of click here, that develop in their 20s and 30s, depression and anxiety, that then in their 40s and 50s have broken teeth, ground down teeth, and have worse depression, anxiety. And then those that have such bad joint pain that now they need and sleep apnea. And then now we have to spend $250,000 on joint replacement or MMA procedures. If that adult had that opportunity to say, if I could have done $9,000 when I was a child and what that impact would have made to that person's life, what direction do you think they would have taken?
100%.
And I try to as delicately let parents know that without the kids in the room, and they can only do what they can do. I got that. This is not a finger pointing thing, but just I mean, what's unique about me, and you were there in your profession, you just didn't get to the children before you retired, is that I dealt with so many TMD sufferers that I am hell bent on getting to these children so they don't have to suffer that.
Right.
That's my fire in me,
Right.
and if I seem like an alarmist or like, too pushy about it, it's because, we've dealt with these patients. We see the tears, we see the darkness. They're strapped to a freaking machine on their face, and this is normal. There's nothing normal about that. I don't wish that for any human being, no child. So I will always treat to ideal with children. And if parents are on board and they're willing to make the appointments, do the follow through with the children and pay for it, I will give them my everything to make sure that child thrives. So,
And there's also non-painful TMD as an adult, okay, because you're dealing with the children and you're preventing what I'm trying to treat or did try to treat. And so you have your pain patients and you do the orthotics. We've been talked about it over and over and over again. But when the upper and lower jaw don't fit together and the gears don't fit together, they're going to break. They're going to shatter, they're going to break, they're going to wear down. And not only that, it collapses the bite. Okay, so to reestablish the jaw to jaw relationship, the teeth have to be built up to and a lot of times bringing everything forward. Now, an 18-wheeler truck has 18 wheels. You're going to change the size of the tire. You can't do it one at a time. You got to change all 18 at one time. And when you take a dentist like me and you, because you both do full mouth cases, this is called full mouth rehabilitation. You have to crown 28 teeth at one time
mhm,
and put everything back together again.
mhm,
That is incredibly intense job. And it's a job it's a very, very traumatic, not traumatic, but it's a big deal for the patient to have to go through, not only physically, but emotionally and monetarily. But if you can, for at this time for $9,000 prevent them from having hundreds of thousands of dollars worth of work and go through all of that trauma. It's just a no-brainer, a
Right?
complete no-brainer.
You never get out of the expense of it. You suffer in some way, shape, or form. We all have to. Both of my sons have been through this orthodontic treatment, like growth guided, incremental growth. Everyone goes through this. It's you're going to decide when, and the longer it waits, the more compromised your results are going to be, and the more expense, not just financial, emotional, social, psychological, all of the above. Full mouth reconstruction, 28 crowns in my office, it starts at about $70,000.
Yeah.
70. And that doesn't include implants, and what about all the years before when that patient had pain and had ugly teeth to them, all that mental suffering? So I don't know. I
Or the man's got a mustache because he's hiding his teeth, or they come in and talk to you and their lips are pursed because they don't want you to see your teeth. That's traumatic. That's emotionally traumatic
it
when
is.
you could have beautiful teeth. So, Pam, another thing, you've been doing it long enough. You get those children's face, the bones, everything in the right place, the teeth fall in line and they're in the right place. Do they break those teeth down because they're in the right place as they
No,
get older? No, they do not break the teeth down. So, what you and I do is so rewarding, but it's also so frustrating because getting the message across, and therefore the reason for this podcast. I know you're like me. You sit in an airport and you say, "There's a person. There's one. There's one. There's one." Or something. I look at my grandkids. My daughter's saying, "Oh, you're looking for something wrong," But that's just us. And thank God I was able to experience this before I retired. And it gives me the energy to do my second career, which is writing on my book, the one on Amazon. And the new one is going to be on Amazon. I'll tell you about that at another time. But it sure makes life exciting and rewarding. And I am so proud of what you're doing. I think it's just fantastic.
I can't imagine doing anything else. I really can't. And I'm excited for, the next 5, 10, 15 years of my career. And my hope is to touch as many lives as I can in my office. But with you, I'm so grateful that you're doing this podcast with me so that, again, we're not monetizing this. Our listeners, we don't get anything from this. We just know that so many people suffer themselves. They're worried about their children. They don't want them to follow the same path. So if we can get the word out, we're trying to get other doctors to collaborate and listen, and we're coming along, and I'm really proud of that. So
So
anyway,
I think about how this podcast came about, and it's really started about 3 years ago when we were asked to do, we were doing marketing for ICMO.
right.
And we got on this dental Facebook group, and we were interviewed. You and I were interviewed 2 different years,
Yeah.
and we did so well, and we didn't plan on it, and so now it kind of morphed into this, which I think is very exciting
Yes.
for me to do. Anyway, I'm enjoying it.
Me too. Me too. And I think it's amazing the amount of people it's reaching. Our listeners, please reach out to us if you have questions, if you want us to elaborate at all. My team and Max, we read all of our own, questions and reviews. So let us know what you want to hear. Okay. This is something that's really important to both he and I. Mac doesn't need to be doing this right now. This is his passion project in a different way as is it's mine. Anyway. All right,
Good.
friendship, wrap it up.
All right, dear. Good seeing you.
Always my pleasure. Take care.
Next time.
Next.
Next time.
All right, bye.